Welcome to the Rooks Health Podcast, and in this episode with the legendary Dr. Bubbs, who is the performance nutritionist lead for Canada basketball for the teens, all the way from 13-year-olds all the way to the Olympic athletes, we discuss understanding weight gain and muscle building. What's the real difference? How do we spot true weight gain from false weight gain? How do we differentiate which one is just water to which is actually you're building muscle? That's one of those main topics we discuss on this podcast episode. And another thing we talk about is a bit about diet. Now, if you've been following the podcast, we've been discussing a lot about nutrition, about diets, because I'm a physical therapist myself, physiotherapist, whichever one you want to call it, to be honest. But I said, let's ask a bit about diets and why is it that you have 30-day diets and then that fails, you start another 30-day diet. Why is it that diets fail? That's a big thing we discuss in this podcast episode. So hopefully you enjoy it and you keep listening to the podcast. And again, you can listen to this podcast on pretty much any podcast platform you have. And also you find some of the videos, the whole videos on YouTube. And I'll also be doing a little bit of chunks. So maybe I'll chunk out a segment and put it on YouTube and share it on at Rooks Health. So you can find it in many places. But let's get into the full episode and see what we're talking about. All right, so welcome to the Rooks Health Podcast. Today's episode is a very interesting episode as we've been following the theme of looking into how nutrition and physical activity play a role in pretty much everyday people as well as athletes and everyone else alike, health enthusiasts. Today we have Dr. Bubbs, who is a sports doctor, nutritionist, and I'll let him introduce himself so I don't butcher his proper titles.
Burke, appreciate you having me on, bud. Yeah, I work in performance nutrition, work with Canada basketball and then Olympic professional athletes on one end. And then I work with general population, helping people, improve their blood sugars, lose some weight, support their heart health. And so, that whole spectrum from elite athlete to general population. And there's a lot of common themes across both groups. So really, really great to be able to see everyone in the population.
So, and before we hop into the real meat of it with the questions, I remember you just said something about Canada basketball. Can you tell the people a bit about that, about what you do for Canada basketball?
Yeah, so with Canada basketball, I work as the performance nutrition lead. And so it's for a whole men's side of the organization. So from our 13-year-olds when they first get identified all the way up to our Olympic team. Ah. And, for me growing up, I played basketball as my sport. And in Toronto, this is before we even had the Raptors. So it was pretty cool to not only see that now in Toronto, there's more kids playing basketball than even ice hockey in Toronto, which is kind of crazy. If you think about Canada, you always think about ice hockey. So it's been great to see that sort of progression and great to be a part of it with Canada basketball.
I play basketball. I play in my uni. I played all through. I love basketball. It's pretty much in my blood at this point now. So that's awesome. Great to hear that you are in the field as well. All right, so let's get into the topics that we want to talk about. So now we're staying on a bit of athletes and nutrition wise. One big question I've actually got this question from a friend of mine. He asked, how do you increase your weight gain whilst maintaining agility and keeping, because I think there's a general myth that if you start building more muscle mass or more weight, you will automatically start losing speed, agility and everything. It's like a sacrifice.
Yeah, I mean, that's a common one that still persists. And I think, we always think if we gain mass, then it's going to slow us down or impact, things like acceleration, et cetera. And I think, to start with, you want to address the training side. I think too often, at least traditionally, people have adopted more bodybuilding style workouts where they're lifting heavier weights and moving them more slowly. And so from a neurological standpoint, they're training themselves to go more slowly. And so from the training program that they be following, you got to make sure that you're following a program that will support the physical demands of whatever sport that you're into. So that side's got to be taken care of. With respect to nutrition and gaining weight, I mean, we want to gain muscle if you're an athlete. Depending on the sport, if it's a contact sport, then you might want to just gain size as well. So you're going to have some body fat along with that. If you're a rugby player, you play on the offensive, defensive line in American football, those types of positions. But in terms of pure muscle gain, I mean, you can only gain if you're gaining 2 pounds of muscle a month, you're doing really well. And so all the other weight that's coming on is from glycogen stores, water, body fat. And so this is where we do have to watch if someone's gaining, we hear all these stories about someone's gained 8 pounds in a week. Well, we got to make sure we're gaining the right kind of weight. And so tracking your weight weekly helps. But if you do gain too much body fat, then you could argue that it would be, would hamper your acceleration, would hamper things like speed, and of course, potentially increase risk for injury depending on your sport.
Okay. And talking about that weight gain and weight gain particularly is because one thing I've seen this, I saw this little thing, I can't remember where I saw it, was that like if obviously people, when you said a week time and they feel like they gain 8 kg, and then some of it is amassed with like water. Is there a time frame to actually know? Because I know if you're talking about muscle strength, it's normally 6 weeks before. That's what I've been taught. It takes about 6 weeks to see true muscle strength. And what about weight gain to see it true without it being masked as body weight, as water or as glycogen, etc. and etc. So you actually know it's the true weight you're building.
Yeah, I mean, it's a very good question, and it's one where most people, even athletes, aren't going to want to be going into a lab to be doing those kind of invasive tests. And so, by simply taking some objective metrics like your body weight, an average of body weight for the week, as well as some subjective metrics like how you look, right, the leanness of the individual, that's going to be a good general way to see over the weeks how you're gaining. So, if you're trying to add mass, we do want you to be getting heavier over the week. So, if it's been 3 weeks and you've still got the same average weight, then you're going to need to increase caloric intake. And so that can come from fats or carbohydrates, protein as well, though typically protein is the first thing that we focus on, and we sort of set that. We can talk about that in a minute if you like. But that would be something to then think about. So the hydration piece, we just don't want to get too carried away with, people who lose weight get too carried away with when the scale comes down, when it could be lying to them, right? It could be just water coming out. Or you see even nowadays with kind of fasting, people love it because they lose weight. Well, your bowel contents, not to get too graphic, but your bowel contents can weigh 3 to 5 to 6 pounds. And so if you don't eat anything for 24 hours, you're just losing all the contents of your bowels. And of course, your weight plummets by 3 or 4 or 5 pounds. And people think this is tremendous weight loss. But obviously, it's not the kind of weight we're trying to lose, right? As soon as you start eating again, that weight's going to come back on. And so this is where, on a weight loss side of things, folks trying to stay away from a lot of the fad. Unfortunately, the fitness industry has done a poor job of convincing people that in 30 days you should be able to transform your body, when really, if someone's losing, again, a pound or two a week, so 4 to 6 to 8 pounds in a month, that's fantastic. And so that, the expectation that people have around weight loss is not what's really in the evidence-based research. And that sets people up for a really tough time down the road, because they're expecting to have this real rapid transformation.
Okay. Now I think that was actually a very good one. Now we're on that one. So my take is that, because I know a lot of people who do fasting and different types of fasting. I actually had a talk with someone else who was in nutrition a week ago. We were talking about the rise of the different diets and I personally, I'm not, I don't promote a lot of diets because of two things primarily. One is I don't know enough about diets for me to be saying, oh, this diet is better than this diet, or this diet is better. And also, I think for me, is the biggest one is caloric deficit if you're losing weight, or caloric surplus if you're losing weight. But how does it? Again, I don't know much. So if you're talking about fasting, what do you use apart from that on fasting, intermittent fasting, and things like that?
Well, you touched on a few good things there. I mean, the first one is to understand the principles, right? Is that all the diets work by the same rules.
Yeah.
And so you can pick whatever diet you want, and there's pros and cons to all the diets, but it is nice to know that you're not necessarily getting any special effects from a specific diet. So all the rules are the same for all the different strategies. And so then you could choose, right? They're all like tools in a toolbox. So, do we want to intermittent fast? Do we want to do low fat or keto or everything in between? And where people tend to get stuck is they just follow a template, which is nice when you get started, but then if that doesn't work, then they just try a different diet, and they never really take the time to assess why they're hitting these roadblocks. And so, I'll give you an example: intermittent fasting, which technically is eating normally 5 days of the week and then 2 days eating very minimally. Time restricted eating is what a lot of people think of when they talk about intermittent fasting, and that's sort of that idea of eating at your first meal at 10 or 11 and then stopping eating at 6 or 7 o'clock. And so you're shrinking the window in the day at which you consume food. And those are both great strategies for losing weight. I mean, ultimately they work because they help to reduce caloric intake, right? If I make you eat, if you normally eat for 18 hours a day and I say you can only eat for 10 hours a day, just by the mere fact that we've shrunk the amount of time in the day that you can eat, we're going to naturally get a caloric reduction in the short term. Now, like anything else, people tend to hit plateaus. So in the longer term, it's normal for things to balance out. And, that's not a bad thing. It just means that that's a time to when you have to reinvestigate your diet and see, where things are, rather than say, well, I tried this type of diet. Now I'm done with it. I'm going to go do something else, because then you're always working at a very superficial level, right? You're not really getting into
detail.
Into the detail. And the details are really the habits, right? The habits are what we struggle to change those. And no amount of switching diets is going to change some of the bad habits that we all have that impair our ability to maintain a healthy weight.
Yeah, I think that's correct. That is actually sticking to it. And you're right, 30 days. I don't know much, as you said, 30 days. And then you say it's not working in 30 days because you've been sold that 30 days is that magic number. If something doesn't happen, you then switch again, try another diet, 30 days. And then it just keeps on the vicious cycle. And because we've talked on losing weight, the big one is for a good amount of people, gaining weight is actually another thing that people tend to struggle with. Even I myself, I'll be honest, I lost about 5 kg when I was trying to gain 5 kg. I was trying to get myself a bit bigger for like basketball, but then I ended up losing a significant amount of weight, and I had to reevaluate a bit and think to myself why. And I realized I changed my lifestyle a bit. I started running a lot more. I wasn't actually going gym as much as I used to, and I think I had to definitely have started eating less. So people trying to gain weight, do they still follow that same concept of caloric surplus instead of a deficit for building weight?
Yeah, I mean, ultimately to gain weight, you've got to be in an excess. And so the first thing we want to do when we're trying to gain weight with, let's say, an athlete, is to try to set the protein intake. Yeah. And so achieve a certain amount of protein intake throughout the day. When we look at amounts, the sweet spot seems to be about 1.6 grams per kilogram per day of protein. Mm-hmm. And that's some of the work by Dr. Rob Morton and Stu Phillips out of McMaster University. And that's a pretty nice place to be. So 1.6 grams per kilo per day, spread that over the day. And that's a great place to start on protein. But where people fall short is that the calories are the biggest signal that will trigger this growth, right? Mm. And so we get a little bit too focused on protein, right? If people are struggling to gain weight, they can just increase the protein. Well, that's not going to help you at that point. You need to increase the caloric intake. And so certain individuals need more than others, and it might mean that an extra 400 or 500 calories a day you might need to eat. And so this is where, when you see professional athletes who gain a significant amount of size in a short amount of time, they've often got professional chefs working with them or team chefs, and they'll be eating 6, 7, or 8 meals a day. And so that's where it's just tough for the person who has a real job and everything else to be doing that much cooking. But ultimately, that's what you want to do. You want to consume, if you can increase meal frequency, that'll tend to increase your caloric intake. And then also some foods are more calorically dense. And this is where it gets really confusing for folks, because so many people are trying to lose weight that if we tell somebody else to consume, fruit juice or to consume more sugars in their diet, that would cause them concern. But for the person who needs more fuel on board, we need to find a way to get it in a really easily palatable way, because broccoli is great for you, but if you keep eating loads of broccoli, you're just going to get full and you can't consume enough fuel to actually get any bigger.
Yeah, no, that makes a lot of sense, because I always when I used to play basketball, I used to think, I want these guys get big, or they have some, but I have to realize that they have pro chefs and everything. So it's scaling it back to what's realistic to you. But another thing I was thinking about is, because I've watched a few documentaries, I've done a lot of research, and one of the things I've mainly heard is not focusing on how much, in a sense, or not in a sense of amount, but also looking at the quality of the food you're eating in terms of like where you're getting from, because I can imagine you can easily get a lot of calories from fast food, like sugars, sweets, and all these style of things, and a lot of rice. And so how do you ration that out to say, avoid, because I don't sense it to excluding maybe carbs off the plates completely. I think there's a room for everything, but that's just me as an amateur talking.
Well, I mean, with any of these discussions, Farouk, we always have to figure out who we're talking about,
Yeah.
right? What's the context? Is this somebody who's, 22-year-old male, female athlete who's trying to gain a certain amount of weight, or a 40-year-old desk worker who's 20 or 30 pounds overweight? Because the context drives everything. And this is what makes nutrition hard, is because it's like tools in a toolbox. And as soon as you change the context, instead of a hammer, I need a screwdriver or I need something else. And so then it's difficult to follow, because people say, well, wait a minute, I thought you said that was bad. And now in this context, it's the classic example is just what you mentioned. When we're trying to gain size, if someone's struggling we are less concerned about the quote unquote quality of the food. Right? We still want to have the majority of quality, but if you can imagine it like a fireplace. If the fire is really hot, the logs are going to burn up regardless of the quality. And so we need to get enough fuel on board. And that's a really important thing, but it's difficult to understand because 2/3 of the population are overweight or obese. We're struggling with prediabetes and diabetes. So for all of those folks, we want the latter of what you mentioned, which is the idea of we want more quality in the food, because the more real food you eat, caloric intake comes down, and therefore it's easier to lose weight. And when we look at the UK, we look at Canada, the US, 50% of everything we buy is ultra processed food. So we're hooked on calorically dense, nutrient poor food. Now, if you're an athlete, it's not the end of the world because you're doing so much activity. But for the rest of us, it's too much fuel, and it causes a lot of health conditions. And if you work in physiotherapy and movement, then this starts to impact the joints, right? The higher your blood sugar levels,
100%.
the joints don't move as well. They're going to be more inflamed. It's almost stickier. And the tissues are going to get impacted, and it's all connected. And so that's where, again, figure your context of where you're at. Are you an athlete trying to gain size, or are you an individual trying to improve your health? And the diet, advice is going to change.
Yeah. And I think you said something that I resonated to immediately was when you start eating a lot more quote unquote real food and whole foods and natural foods, those caloric densities are not high. Because I myself, I eat a primarily plant-based diet, and I noticed that to try and gain weight on a plant-based diet myself, because of the way I'm eating, it's a bit harder than if I was not eating a plant-based diet, where most of my things I try and cook as much as possible, or they're natural vegetables and plant-based, generally plant-based substances, and those I can imagine have lower caloric. They're not as calorically dense as others. So that's where you make.
Yeah, I mean, if you eat more real food, it tends to help. Although if you're trying to gain weight, then things that contain more, if we talk carbohydrates, more carbohydrates per cup, let's say. So things like rice and pasta is going to provide more carbohydrate than even white potatoes or sweet potatoes.
Okay.
And so those are strategies that you can go for. And the nice part with a plant-based diet is that you can get a significant amount of carbohydrate with the meals. If you look at, a meal that contains rice and beans, already we got a good dose of carbohydrate. And so this is where, for that individual who's trying to gain size on a plant-based diet, it's that idea of feeling full now, because you're going to typically have a lot more fiber in a plant-based diet, which is great for overall health.
Yeah.
But again, if we're trying to increase your meal frequency, we need you to eat more frequently. Than if you're full all the time, then it's tricky. And again, context is everything, but that's one. It's, you can play around with that. Things like smoothies and juices are great because you're getting just more caloric intake in a liquid, right? So especially for an athlete, after you train, after a basketball game, we have our professional players and elite players, they're having a drink that has a lot of carbohydrates and protein in it that they drink because they're thirsty. And then an hour after that, they're hungry again for dinner. And so you've got this opportunity to get a lot of calories in as well as protein, which is really important to be able to recover. And then for those who are trying to gain size as well.
And I can imagine that does make a lot of sense, trying to get as much food as you can. Just generally trying to keep eating and eating as possible. It can be a bit tricky. So finding that balance, I imagine, is the tricky part. But once you find that balance, it makes it a lot more easier.
Yeah, it's all about habits. I mean, once people get used to it, and typically when you have an actual chef preparing the food for someone who's trying to get bigger, and you give them a sample day of how much to eat, the first thing, their eyes pop out because they just immediately know, like, this is way more food than I normally eat, right? And so automatically, even from a simple heuristic or simple rule, they can get the sense of like, oh, okay, this is how much we need to now eat if we want to get, and so it's just being exposed to it. That's a big thing. And then developing those habits again, for the athlete who's trying to gain mass, lots of meal frequency. And then for the client who's trying to stay leaner and just improve their health, we're actually trying to get them to reduce meal frequency. So you can see how things shift depending on the goals.
I can imagine so. And while we're still on the topics of diets, this one is a bit of a funny one, but I wanted to get your take on, because I know there are loads of diets. You go paleo, keto. Actually, I want to ask you about keto, because I know a lot of people who are actually on the keto diet. And I think what is something that is important that they should know that probably they're not getting told when you just listen? Because I don't think a lot of people go into depth when you pick a diet. And I think that's something very personalized. As you said, context is important. And if you want to pick a diet like that, that's restrictive, what do you need to know?
Well, I think the first thing is always to start out. I mean, there's so much arguing about nutrition on Twitter, even amongst experts, that it's even the general public starts to block out all the noise, right? And so the first thing, if you've started the diet, I mean, good on you. You're into nutrition. You're starting something out. That's terrific, right? That's what we want to start with. Now, any diet's going to have potential limitations, and the benefits of a keto diet for a lot of people is that they tend to increase their protein intake. They tend to reduce dramatically their processed food intake, because most processed foods have carbohydrates in them. And so if we eliminate all of those, then the processed foods go way down. Although now we see more companies producing processed foods that are more keto based. So you've got to watch, that'll come back to bite you in a few years. But so that's a good thing. Now, in terms of, things to watch out for, people tend to get a nice weight loss initially on a keto diet. Mm-hmm. And then they plateau, and typically they plateau because they're just simply eating, right? There's too much energy. And so they're eating too much fat. And even if those are really healthy sources, you can eat too many avocados, or you can have too many egg yolks, or you can have too much butter or whatnot. And so you need to reduce, right? And this is that idea of, again, like, you get those easy wins when you first start an approach, but at some point, no matter what diet you pick, there's going to be a little bit of detective work and a little bit of hard work to figure out what you need to do. But once you do it, if you can develop the habits then after that of how you need to switch your diet, you're able to maintain that success. But that would be a common stumbling block, is the person who's done well on the keto diet is typically at some point they're going to need to reduce the fat intake.
Oh, okay. So it's back.
So you can't eat as much fat as you want, even though you hear even some medical doctors say, just go for it. Eat as much fat as you want. You can lose weight. Well,
fully.
Up to a certain point.
Fully. As you said, if you imagine, nutrition is something that everyone, even in physiotherapy, I go into physiotherapy to the arguments almost every time regarding something, because there'll be a lot of studies that say, oh, it's good, and a lot of studies will say it's bad. And then people I think it's also come down to a bit of your personal beliefs. To be honest, as a practitioner, that's all you can really do. You can really only go off what you think is right.
Well, that's the idea. Even when we practice evidence-based medicine or evidence-based practice, I mean, that still only means the evidence-based is only a third of the equation, right? You want to take what's in the evidence, of course, to inform what you do as a physio or strength and conditioning or nutrition. But we also need the other thirds are, your clinical experience. So that the individual's clinical experience and working with it. And then the final third, which everybody seems to forget, is the patient, right? What are their beliefs? What do they buy into? Right? Because if they don't buy into it, you're not going to get it. Less so if it's an acute injury. I mean, if someone has an acute injury and they need physio, it's not as, or a medical intervention that's acute, that's less relevant. But when it's a chronic condition, I mean, the buy-in and belief is huge, right?
Very much.
And so those three components is what we need to be able to help people in the long run. And for nutrition, it's tricky because that third component, people are getting tugged in different directions, right? Like your mom or your brother or your sister has an opinion, and your teacher has an opinion, and your strength coach, and so everyone's chiming in. It's difficult for people to follow, something. Yeah,
I can imagine. So with this nutrition, to start out the gate is already a difficult one. But if we're talking in terms of, because I'm a big believer that your body, I never forget, one of my people I know, he told me that your body doesn't forget what you eat. What you eat now significantly matters in the future. And it's something I put in my head a lot of the time, is that long-term effects. You may not see if you eat, for lack of a better way, if you eat like crap, short term, and you're eating and you're not seeing those symptoms, you're not really seeing anything. In the long term, it may come back and bite you most of the time. So what are your thoughts on the long-term effects? Because I know there are long-term effects, but long-term effects of poor nutrition, poor health, poor feeding.
Yeah, I mean, you see it all the time in athletes, especially young athletes, or if you're a young active person. I mean, when you're younger, you just get away with more, right? You've got wider buffer, right? And so you can be consuming a lot of sugars and a lot of processed food and fast food, and your blood sugar control will still stay pretty good, and your triglycerides will stay pretty low because you're active and exercising. But it's more to do with the fact that the person's on the same diet as they get older versus what they ate when they're 20, influencing them when they're 30 or 40. It's more to do with if you have the same habit when you're 30, especially when you're past 40, now all of a sudden you don't deal with glucose nearly as well. So that same Slurpee or, Coca-Cola that you had before, now your blood glucose response is much more exaggerated. So we're going to have peaks and valleys. You're going to feel fatigued and tired. You're going to have more cravings. And so it just becomes more exposed. And so basically as you get older, the window the buffer gets smaller. But the best thing is the more active you are, it helps to widen that buffer as well. The more muscle you have on, it helps to improve that as well. So those are all factors that are key, right? As a physio, somebody who works in movement, if you can keep people moving and keep muscle on people, you're going to do really well, regardless of the nutrition approach that you pick.
And that's actually a good one, because that's something I think, based off even physio, is that some things are inevitable in terms of old ages, and getting older is inevitable. But I think depending on where you are at, so as I said, if you have good strength, if you had good balance, if you've been developing these things from a young age, from your 20s, your 30s, by the time you're 40s and your body naturally starts to plateau or naturally starts to go down a bit, and that deterioration, and it's quote unquote, it's not me sounding ageist or anything, so sounding ageist, but that deterioration, it can be slowed down, or it can even be slowed down negligibly or at a much slower rate. So as you said, if you're building
absolutely. This is where nutrition really shines, right? You see what athletes are doing now in their late 30s, guys like Roger Federer. We have basketball players like Grant Hill played until they're 39, or Steve Nash until they're 40. Ice hockey players played until 40. This was unheard of a generation ago. When I was growing up, when you were over 30 as an athlete, it was close to the end. And so that's nutrition playing a really big role. Things like sleep as well, and of course some of the therapies and treatments. But definitely, we see as an average after 40, we start losing muscle mass and other things. But we could definitely, from 40 to 60, you can have a really long window there of maintaining and even improving. I've got clients who can deadlift more at 60 than they did at 40. And so this is where, our bodies are plastic, our brains are plastic. The inputs that we give, we're going to get those responses back. And so if you're not moving and you're eating poorly, well, that's, you're going to get that back out, and that's going to how you feel mentally. And if you are active and you can lift a few heavy things now and again, and put some good food in, then you're going to feel it, your joints, your mindset, energy levels, all that kind of stuff.
It's going to really pay off on the long term wise. And the choices, I think the choices you make now and the choices you carry across that long period of time really does make that difference.
Sure. And as a physio, if you're treating clients who are in their 40s or 50s, even in their 30s, if their diets are poor, it's going to be harder for you to help them, to rehabilitate them. And so this is where, it's great that this is an area of interest for you, because if you improve their diet a little bit, even when you're 40, 50, 60, 70, now all of a sudden things get better faster, which is nice if you're a manual therapist, physio, etc.
Yeah, I agree exactly. And one of the things, if anyone listening to this, or one thing I also want to talk to you about was when you look at, because I have this in my head, very ingratiated and very stuck in my head, of holistic health is basically incorporating, my last one out, incorporating the many pillars of health in the sense of nutrition, physical fitness. Because if someone comes to me and I'm not able to just if you ask me for basic health advice, health or food advice, or is this bad to eat? If I can give you if I can do two things, either one, refer to someone who knows a lot more than me as yourself, or give you a little bit of a basic tidbits that you can still say, okay, that's knowledgeable. And if you feel you still need more, you can carry on and going. And I think often, even myself, you forget to look at the whole 5 pillars of health, which are, what's it called? I think it's mental, physical, and et cetera, about how that can play a role. Because I can imagine if you're having, I don't know, you correct me, if someone comes in and they're not eating well, or they're generally unwell, and you're looking only into their feeding, it could go a lot faster if you also thought about, how active are you, or things like that, and vice versa.
Yeah, the big thing with nutrition is building rapport. And so, even the model we have with nutrition that's still around in terms of a clinical model of somebody just going in to see a nutritionist once a month or once every few months is a pretty poor model, right? If you look at my background's in strength and conditioning before I got into medicine and nutrition. Yourself as a physio, when you see clients more frequently, when I was a trainer and I saw the same client 3 times a week, every week for months and months and months, you build a lot quicker rapport. Now, all of a sudden, it's much easier to start to layer in nutrition changes that you'd like to see. And so that's a big component of, so if you're a therapist or a practitioner listening in, it is, as much as we need individualization with nutrition, the fundamentals that are common across all of us are still 2/3 of the whole story, and maybe even 80% of the whole story, right? There's a great paper said personalized nutrition, what makes you so special, right? Like, we'd like to think that we're all snowflakes and there is individuality, but there's a lot more common themes that we need, the big rocks, right? The fundamentals, the same thing in movement or in physiotherapy that people need to do before they get to the smaller buckets or the smaller rocks, which is the personalization. And I think sometimes we overemphasize personalization when someone doesn't even have the fundamentals, right? They want to do a certain lift when they can't even do a proper squat yet. It's like, wait a minute, let's get this first, and then we can go there. Because if we don't have that, then it's never gonna, we're never gonna get that benefit we're looking for.
100%. It's the basic building blocks, and then you go up from there. You can't start off at the top of it with the extremes in anything in particular. And as you touched on a bit of lifestyle changes, I think lifestyle tends to be a word that can either get misused or it can be used for a different context. When someone talks about lifestyle, the first thing they think of is, are you doing my lifestyle? Maybe you're doing a lifestyle blog or something. But I think of, when I say lifestyle, it's lifestyle changes. And if we're talking about food and feeding nutrition, what are those little things that, if you're trying to aim for, obviously, the quote unquote, the optimal health or optimal nutrition plan where you're eating good and your body feels well, what are those little changes that someone can add into their daily routine to get those benefits?
Yeah, I mean, that's a great question, because we're always trying to nudge people towards the right behaviors. And, even sometimes using the word optimal, I mean, there's a cost to optimization, and most of us, when we're busy and whatnot, optimal is kind of a long way away. So sometimes that can even, dissuade some people, because they're like, man, I'm so far from optimal. But a small thing that you can do, what you're alluding to, obviously, is being able to make some small changes to get some bigger dividends, bigger payouts in terms of health and wellness. A very easy one is to just stop snacking in the mid-morning, right? Between breakfast and lunch, right? If you're someone who's looking for overall health and you're looking to, control blood glucose levels, even somebody who's lean, who's got 10% body fat, has got 30,000 calories of energy on their body, right? They could run from here to from London to Istanbul without any fuel. And so it begs the question, why are we so hungry between 9 a.m. and 12 p.m. sitting at our desk? We're not even moving. And so when we talk about behaviors and habits and becoming accustomed to something, most of us have programmed in this idea that we want a snack, or the brain's expecting a snack, or the breakfast that we're choosing to eat creates a rush of energy, and then the blood sugars come down and we become hypoglycemic. And so now all of a sudden you're at your desk and it's like, oh man, I need a coffee, I need a sugar, I need something. And so this is where, it's coffee and tea contain caffeine. They're natural appetite suppressants. They also contain polyphenols, so they're a tremendous source of antioxidants. And so that's an easy win. Cut out the snacking. It might be tough for a day or two, but by the end of the first week, you'll be amazed at how you can go from breakfast to lunch. And now we've set a behavior. If that's what you do for 6 months, for the rest of the year, for the next 5 years, you've just cut out 200-300 calories a day, which is going to be a big win at the end of a month and a year and going forward, right? So that's one that, now if you're an athlete, it's a different story, but for the general population, that's a pretty good, even if you're an active person, that's a pretty good suggestion.
Yeah, that one is a very interesting one, because snacking is something I've thought myself. It was not easy to cut out a lot of snacking, because snacking regularly, you never tend to, when you go grocery shopping, snacks is a whole segment of things you have to get, and you're used to buying a thing. So I think if you can fight that urge, it's a similar thing with me when I started my diet and I stopped drinking regular cow's milk. At first it was weird, but then after a week or two, you don't even notice it, and your brain already is like, well, I guess that's it now, and forgets about it.
Get used to the new thing in the diet, or the new behavior, right?
Exactly. So that's one thing you can do if you're thinking of starting to cut out all these things. And how much of a role, quick one, is the snacking play in weight gain? I can imagine it's significant, but how significant?
Well, I mean, it's really interesting. If you go back to before the 1970s, I mean, the percentage of household spending outside of the home, so on things like snacks and even meals, that was very minimal, right? Most people, my parents' generation, I mean, they ate all the meals in the home. And then in the 70s and 80s, snacking became, let's have one snack a day. And then, all of a sudden in the 90s, the recommendation was to have multiple snacks a day. And so Dr. Kevin Hall, who's a researcher at the National Institute for Health in the US, looked at some of the data on household spending on snacks. And since the 1970s, this is 4 or 5 decades, and it contributes to about an extra 425 calories per day in the general population, which by itself is enough to explain the obesity epidemic that we're struggling with now, which I mentioned. Again, most developed countries, 2/3 of the population, Canada, the US, the UK, are overweight or obese. And so we're struggling now because our food environment contains loads of tasty processed snacks that make us want to eat more, and they have a lot of calories. They don't make us full. And so that's one where, again, having a snack's not the end of the world, but finding spaces in your day where you don't need to eat, right? It's not, your body has enough energy on it. You can get there. It's more just, it's become a behavioral thing. And so that's one where it's an easy win to do that. And of course, the toughest one to change in folks is late night snacking, but that's another story.
That's a fight for another day. And it's quickly touching on, as you mentioned, obesity topic. This is me just getting very curious now. You said some things, it just lit up some things in my head. Was the obesity? I was listening to, I don't know, it was on a podcast or I was reading somewhere, and they said that, I don't remember how long, but let's say 40 years, for example, 40 years ago, the spending on food in, for example, the US was actually higher, but the amount of spending on medicine was lower. But now you find a very significant flip where people are spending a lot more on medicine and then a lot less on food, because food, $1 you can get a whole meal for $2, £2, £5. You can get, so spending on food is significantly cheaper, but medicine and long-term illnesses are significantly higher. Is that correct, or they sound right?
Well, the trouble with chronic diseases is that if you're a company that sells medications and you have someone with a chronic disease, you've got a customer for life, right? So if you have type 2 diabetes when you're 25, I'm going to sell you medication until you're 80, right? And so there's a bit of a conflict of interest in the sense of, and we see this more pronounced in places like the US, where there's, totally private healthcare system that, is meant to have competition, but doesn't appear to, because, drugs in the US cost more than they do in Canada, right? And we have a national healthcare system like over here in the UK. Simple procedures cost 3, 4, 5 times as much, but all this is being covered by insurance companies. And so, the long story short is that if you can support your health by what you eat and how you move and lifestyle factors, and not beyond medications, if you need medications for periods, absolutely, use those medications. But if you can keep your health to a point where you're off of those medications, that's a pretty darn good predictor of healthy aging and wellness.
Okay. That does make a lot of sense. See, that's one of the things. These are the type of things that just genuinely interest me, and just get me a lot of curious. And I won't put my conspiracy theorist hat and go down that rabbit hole.
Save that one for another day.
Yeah, save that one for another day. But no, that was great. So if you're listening, we're going to do a quick part 2, which we'll talk about some other topics, but you have to, obviously, to hear the part 2, you have to make sure to tune in for next week. So we'll leave it there for now, and then we'll hop on in a bit.